There are a couple things that you can do to expedite the start of surgery. If you have a male patient that you know is going to be shaved, like most people, you put the razor on the patient's legs once they're asleep. And then what I also do is I take about 4 strips of 12-inch long strips of tape and I hang it from the light above. And what that does is it's right there and ready when the surgeon is ready to shave. And secondly, it keeps the roll clean, because instead of bringing the roll up and then using that and then having hair stick to the roll afterwards, which I've seen, this keeps the roll clean, so it works really well. Another thing is, at this time, and we're going to say when I'm draping that it's going to be sterile, but not yet. So at the beginning of the case, anesthesia is inducing the patient. By then we're usually pretty much ready and just waiting for anesthesia to induce and then get the OG tube in, secure the tube and all those other things. So we can actually help, but if they're going to be putting an upper body warming blanket on, the forced air one, you can actually put it over the patient's legs at the beginning when they're asleep, and then put the tape sticking up. Put it upside down with the head down at the patient's feet, and this part, the sticky side up. And then when the patient's asleep, you can bring it right up. This works on any patient, but it works really well on patients that have large breasts or breasts at all that you have to do. So you take the tape off and the person on the other side is helping you with this. They're doing their side. You put your hand, one hand under the middle so that you can control and keep it high enough and out of the operative site. And then you go just below the nipple, making sure you keep the tape off the nipple. And the other person would be doing their side. And then if anesthesia is still securing the tube and not ready yet for you to cover the patient's face, you can just curl it up. And they usually appreciate that, because that's one less thing for them to have to worry about. And then they can put it up as they need. Another area, I was always taught that a nurse that doesn't use their head uses their feet. So here's a way to be a little more efficient, that I'm using my feet, using my head instead of my feet. If the scrub tech is busy gowning the surgeon, whoever else needs to be gowned, and you've already gowned and you're ready to come in, which happens a lot because the surgeon preps, I go outside and scrub, I come in and I'm gowned and ready, and the scrub tech is usually gowning the surgeon, so I can go ahead and start draping the patient. So you take your towel, and instead of taking just one up at a time, you can ball it in your hand like this, and take your other one from the back table, and then you have 2. And as you lay it, now this of course is being done sterilely, you lay it on the patient and you can see that came nowhere near touching anything that's unsterile. Then you can do the top side. And then on the next one, you're on this side, you grab your skin gun, because you know you're going to need it if you're stapling on the drapes. I'm going to try not to staple my son because he's awake and alert and he might yell. So you're there and ready, okay? Put your staple in, and this has been prepped, this is sterile. Go to the back table, grab your last towel. You can leave the skin stapler there, and you can come on the other side and do the last towel. Now at the end of the case, what happens if they have skin glue on here, and you can go ahead and take the drapes down and clean it without bothering the glue if it's not dry. If you put your hands under the fenestration of the drape and you lift up like this, you can see how you can control it and keep it from going on the area that would have the glue on it.